was thinking, well, this might be sort of cool to be recognized for the position that I was in as a cancer survivor.
I chose her because of her strength of spirit. I met Georganne in a family medicine clinic for just a routine checkup.
I've always been open in my clinic visits. When the doctor comes in and says, well, we're going to have a student with us, is it okay? I know that that's how they're going to achieve greatness one day. And when Sonia came in, she had this big smile and introduced herself, very personable, shook my hand.
She really opened up to me and talked with me about a lot of things that have affected her life and have been important to her, including her faith and her family. And you know, she even shared some of her poetry with me and family photos. And I thought, you know, that was really special too, because I got to know more of her than just her cancer battle.
Georganne is from Colombia.
When I first got the call, it was like, well, why me? I wasn't quite sure what I had done or said that would have caused her to look at me with anything to tell.
More so for me to be able to let one of my patients know that they really mattered and made a difference to my alert. At the heart of the Legacy Teachers program for me is honoring a patient who has been very impactful on my training as a future physician, and also about saying thank you and making sure that that patient knows how much of an impact they've had on me and how much learning I've had from them and their experience.
The Legacy Teachers program, to me, it's not just the clinical setting, it's the person side, you know, where the physician says, I understand her disease, let me understand the person that has this disease.
It is a big way to say thank you to your patient for the impact that they have on our lives.
When we first met, she was there and kind of like listened to me. It's all I really needed.
Coming into medical school, one of the things that was really important to me was to maintain who I was as a person throughout medical school. And how quickly does that disappear when you start on your first rotation?
I have Ehlers-Danlos syndrome, which is really weird in a sense. When I was younger, it was something no one knew about. I kind of want people to learn how to recognize it and help us deal with it, so the more that know it might be able to help me.
She did a really good job at pointing out things that her clinicians might not know about her, like things that she would have to modify at home or do differently to maintain her independence. She would modify some activities so that she could do things herself, but she would also make sure that others maybe didn't know about it. She was private about it because she wanted to be strong and independent, and that's not something you could always see.
I like the fact that someone will take that extra time with you to either explain something better to you or sit and listen to you try to say something. Maybe not even in like the doctor lingo. Maybe use some words that like we all understand, and maybe to take the extra step of outside of like what your book says to do.
Every time I started thinking about legacy teachers, I couldn't stop thinking about how I had this clinic appointment that made such an impact. In this case, the physician gave us a little bit more time to kind of have a thorough discussion. It became a pretty easy decision to write about it. Reflecting on things with Kelly, I started to realize that, you know, I wasn't taking advantage of those parts of my character that I came into medicine thinking like, this is what I have to offer people. Like, this is why I will make a good doctor. I've kind of contemplated a lot on how I can work with schedules and juggle to like make some adjustments in a day to try to make time for patients and get the full story. She's taught me a lot about things outside of the physician textbook.